wanted to take a closer look at the digit PIP and DIP extender splints. They're based off the I splint for progressive elbow splinting and extension. We have some models that we've made, and these are kind of confusing if you haven't seen it done before, so I want to give a little more information. And the strapping is the confusing part if you haven't done it, and it's the most important part. The splinting is less confusing. Some previous patterns, to build the pattern, you would focus on the finger that the patient needs the splint for. You would lay their finger out, add a little width to it, and you try to center either their PIP joint or their DIP joint. Cut a T window. And then one trick is, since they're so narrow here, you don't want to cut and remove the windows. You want to fold the windows back when you make the splint to give more rigidity and keep the splint strong. So that's one of the tricks. You can see it on these rough models. Is that when you cut the window, you fold it, then you stick it to make it strong. So once that's made, and these are rough models. Generally, you want the splint to be near 0 degrees. You want it to be pretty straight, because the splint is the goal range of motion, and the strap is going to be pushing their finger in towards the goal. So again, if you can imagine someone having flexion contracture, they would fit in their splint kind of like this, and the strap, when done correctly, would pull some pressure on that joint and push. As this splint would go tighter over time, it would pull that finger more straight. What I've noticed is that when you make the elbow version of this splint that we use, you would use Velcro for everything. I noticed, especially with the finger, that the more Velcro you have that can be removable, especially if the strap can come completely off, the patients get confused on how to put the strap back on. So I started riveting one side so that the strap can't come off, it's stuck on, and that makes it slightly less confusing for the patient, I think. So the strap can't completely get lost and they have to put it on from the beginning. So I've been riveting one side, and then once the finger's in place, the strap goes over the joint you're trying to straighten, back through the window, and then up onto the top of the finger. Pull nice and tight to the patient's tolerance. That's roughly it. And then the rivet side comes up on both sides, just to have it double reinforced. So if they are putting a lot of tension on this, it's not going to break. This is a more basic model that I first created when I switched from the elbow to the before I put an elbow splint on a finger. I did a really quick prototype, and this is non-elastic strapping, but same principle. It's riveted on one side. Finger would go across, up around, finger back through the window, and then pulled tight and stuck.